Hello and welcome to another week of Core Balance Coaching. This week is just a Q&A for you, the students, for Core Balance training, and I'm going to take any question you have. So we were wanting to do a topic this week, but it's been a learning experience, a little bit of a learning curve for me to get used to this anatomy program that I'm trying to show you guys. So I'm going to put it off till next week, and we are still taking topic requests in the Student Hub. So don't forget to post in there if you want me to talk about a specific topic, and I'm planning to do one next week. Using this new program. I did give you guys a little bit of it a couple weeks ago when we talked about the psoas and pelvic tilt. So it's a learning experience getting used to this anatomy program. But I'm excited to use it, and I'm excited to have this tool for you guys to be able to teach more about biomechanics and anatomy related to back pain. So, not too much to announce other than that. We have put some new lessons into the program. Let's see, they're more replacement lessons. So for people who are in module 10 and 11, we've put in some new active hip stretch and active shoulder stretch lessons, and there's a lot more coming down the pipeline. So that's exciting. We are getting close to finishing up on lots of new lessons that are going to be going into the program. So look out for those. We'll be announcing those. We didn't announce these recent ones because they're more replacements of old lessons. Just with, I've learned what to say, what you need to hear, and so they're updated versions of old lessons, just with better teaching, I believe. So, without dragging on too long, I just want to get into the chat, answer your questions. So let's go ahead and do that now. Hopefully you can all hear me okay. Hopefully everything's working okay. Let me know if not. And let's see if I can switch over to you guys. There we are. And we'll get into the chat. So I already see some questions from Miss Tran, familiar face, and we'll start with her. So it says, hi, Dr. Ryan. Can you introduce or suggest some advanced hip active stretches? I like doing the one in module 10 or 11 where we have to lift our knees to work the internal and external rotation. Yeah. So that's funny. That's one of the lessons I was just talking about that was replaced. So I'm not sure if you've seen that very recently, Ms. Tram, but if you go there today, it is a brand new lesson that we filmed recently. So be sure to check out that updated version. And yeah, so we can talk about more ways to stretch the hips in an advanced, type exercise. All of them are going to involve active motions. So I'm not going to be suggesting anything like the figure 4 stretch or anything where it's relatively passive stretch and you're just pulling your hip to your chest and holding it there with your arms. We want to be stretching those hip muscles with the hip muscles. So the muscles are stretching themselves, essentially. And the reason why that's more beneficial is because the muscles are learning neurologically how to function in that stretched position. So it's a neuromuscular system, not just a muscular system. So we want to be able to train the muscle how to function in the new position so that it feels safe to remain in that position and to maintain that stretch, that new range of motion that you're asking it to have. And we all know, we've all been in the cycle of stretching where
you stretch and your muscles tighten right back up within hours, and then you stretch again, and that's just the cycle that you live in for forever. And that is related to just passively stretching a muscle. So if you want to get out of that cycle, it's going to be any stretch, any way to bring a joint into a new range of motion while also using those muscles that do that. So yoga is a good example of that. There's lots of different types of yoga, but if you're doing standing postures, and I believe they call them asanas, where it's effort. It requires effort to get into that position. Then that's the general rule. So there's a lot, and so yoga would be a good example. Not so much like yin yoga, where a lot of those poses are passive, and you're just resting, relaxing into them. That would not fall into the type of stretching that I'm talking about, which is active stretching. So usually these active stretches take effort, and so, yes, so warrior pose. I have a couple later in the program, such as the typewriter squat. So believe it or not, that is a deep hip rotation stretch as you are typewritering over. You are rotating your hip using those muscles. And you can also, this applies to everyone, you can turn almost any passive stretch into an active stretch simply by contracting that muscle in the stretch. So, for example, pigeon pose. Pigeon pose is a yoga pose. You can look it up. It's generally pretty passive, where you're just using your body weight to stretch the hips. But if you were to take that bottom knee that's down on the ground and push it into the ground and use that as a lever to push your torso up off of the ground. So it now becomes a functional movement. You're using your hip muscles and your leg to push your torso away from the ground and then lower yourself back to the ground with those hip muscles. And you can assist with your arms to the degree that you need, but the primary goal is to be training those muscles. That turns pigeon pose into an active stretch. And I really enjoy that one. I used to do it a lot more before I had my struggles with SI joint instability. So if you have SI joint pain or are struggling with that, that's pretty stressful on those joints, and I would avoid it. But if you're not, then that's a good deep hip stretch that I would consider if you're trying to get that range of motion. Yeah, so good question there. And that would be more external rotation. Internal is hard to get. Hip internal rotation is a hard range of motion to get. And I really like that module 10, I think it's module 10 or 11, seated stretch for that one. That's probably my favorite one that doesn't really stress the knees too much. You can really torque your knees a lot by trying to stretch your hips in internal rotation. So that's a safe one for the knees. And that's the main one I would recommend. Okay, Patrick Dubé. Sometimes you refer to the deep squat as a beneficial posture for back pain and sometimes as something that will overstretch ligaments. This is confusing. Please explain in more details. Great. This is a really good question. So let's talk about the difference between active deep squat and a passive deep squat. So when you go down and sit on your heels, like is very popular or common in Asian countries as just a resting position to sit in, your muscles aren't really engaged, right? It's a resting position. And so that means you are hanging on a different piece of anatomy. Usually it's going to be the ligaments, unless you're so flexible that you're literally sitting on your heels, then you're not hanging on anything. You're actually sitting on a surface. But in the case that you're not crazy flexible, you're you're hanging on something and your muscles aren't holding you up, so it's the ligaments holding you up, and that would be stretching the ligaments. And in a normal person without any conditions, that should be actually fine. It should be not cause any pain or irritation. But in someone with a condition that is similar or irritated by stretching out those ligaments, such as most SI joint conditions, most SI joint type pain-related conditions, or people with disc injuries. So if you have a bulging disc or a herniated disc, those bulges, we can look at a picture of a disc, if I can find one. Those, I don't know if I have. Those disc injuries are usually on the posterior side of the disc. So what that means is if you're doing deep forward bending, or a deep squat would be an example of forward bending, you are essentially putting those tissues in a lengthened position, making them taut. So here's a picture of a disc. Here's a picture of a disc bulge. So this is the posterior side of the disc. And it's actually not the best view, to be honest, because when you forward bend, you're stretching, you're lengthening from an axial perspective these tissues. And I'm looking for one right now. So okay, we're gonna have to go with this one. It's not ideal, but better than nothing. Sorry guys, I hate when this happens. Looking for an image. Is that one? None of these are really ideal. Okay. I'm going to zoom in really far. All right. So if this person were to forward bend, they're actually lengthening the back of the disc, which is the compromised part of the disc. So it's actually already bulging, already stretched out for whatever reason. So you're taking that bulge or that compromised tissue and you're stretching it, lengthening it in a deep forward bend. So someone with that condition may be irritated by stretching those tissues. A stretch is ultimately taking a tissue to its fullest length and then lengthening it even further. You wouldn't want to do that to an injury. You could imagine an ankle sprain or a knee injury. So it's going to depend on your condition, but for someone with stenosis, which is extremely common, forward bending is not going to generally bother them because it's not similar. Forward bending is not similar to the problem, or the cause of the problem, and it's not. Those tissues aren't lengthened or those tissues aren't compromised because of chronically being lengthened. So all this to say, a deep squat is very similar to a extreme forward bend if your pelvis is tipping backwards and stuff like that. And so so we'll circle back to the first thing I said. If you can do a deep squat and keep your muscles active, so you're never actually let go of your muscles, and as you go down, your muscles are supporting your pelvis and your spine, they're active, the neuromuscular system is firing all the way through, all the way down, all the way back up, then you never actually release the tautness of the muscles and put it onto the ligaments, theoretically. I mean, I guess theoretically you could have both be taut at the same time, but at least to some degree you're going to have support from the muscles, and that's really the difference. And So yeah, you can squat all the way down and back up with your muscles engaged and active, or you can squat all the way down and fully let go and let that tension transfer into maybe tissues that you might not want to, or depending on your condition. So hopefully that helps explain to you, Patrick Dubé. And so just to sum up, like somebody with stenosis or spondylolisthesis would probably get relief from a deep squat. Somebody with SI joint pain or, disc issues that are from repetitive forward bending flexion, they may actually feel soreness after that. All right. So M. Draper, is the push away concept while sitting supposed to be indefinitely sustainable? Good question. Such as while working or a long car ride, even if just an hour or two. I think I'm doing it right, but my back gets tired fast. Is it indefinitely sustainable? So the push away is not a very specific amount of effort, right? It's really just a concept of, if you want to correct your posture, instead of lifting yourself up, actually sink down and push away from the surface. So it's not an amount of effort. It's not a amount of lift or weight or anything that could be quantified. It's just a switch in your intention. I'm going to switch my intention from lifting myself to pushing myself away, which requires a downward force. And it just engages different muscles. So depending on how intensely you're doing that is going to affect the sustainability of it. If you are doing it at a 1 or 2% level, then yeah, my answer would be yes. I imagine that you could do that throughout your waking hours. I mean, there are a lot of muscles that are engaged like that, or should be engaged like that throughout the day. For example, the deep core muscles. And they are designed for long-term engagement like that. They are postural muscles. If you are using the wrong muscles, for example, trying to use certain muscles that were designed for movement, such as your rectus abdominis, your six-pack abs, or your superficial paraspinal muscles, like the ones on the surface that are designed to extend the spine. Those muscles are movement muscles. They're not postural muscles. They're meant to be engaged for short bursts and not long-term, low-level engagement like postural muscles, such as the deep paraspinal muscles, the multifidi, the transverse abdominis. I don't like getting too deep into the names because at the end of the day, it's not going to help. What really helps is the feeling of getting connected with the deeper muscles of your core and learning those low-level amounts. It's an art, really, of engagement, learning the intention. The push-away intention is more likely to engage these healthy muscles. When you're doing the push-away from your back anchor, you're going to get that healthy engagement. And so you want to learn how to try and apply that to the sitting push-away. And but if you're doing it intensely and your back is arching, that's actually too much, that you're bringing too many muscles to the party, probably bringing in some of those superficial muscles that are designed for movement. And so you want to let off and think, okay, I really am trying to feel the deeper muscles. And so that's, in that case, you would probably get tired pretty quickly. I would be impressed if you could make it to an hour engaging those muscles. So, they get tired much quicker than that. So super low level, I'll be honest with you. I don't really think about the push away consciously very often. Sometimes I have to reset if I've been sitting for a while, but it's more of just a general intention of when I'm at a computer, I'm thinking about working at the computer, but behind the scenes, subconsciously, I have this push away intention happening, just like I'm breathing at a certain point. So it becomes that, and it's super low level, and it does fit together very well with the breathing. So breathing into your lower back, sending that breath down, right? Down and back. So the effort is going down, and it's having the effect of making you a little bit taller. So hopefully that helps. And then you had a follow-up question, but I probably answered it, hopefully. Or perhaps I should say that the muscles which support this posture get tired quickly. Yeah. So it's just communication to you that maybe the muscles that you are engaging are not meant to be supporting your posture long term like that. And so maybe get down on the floor, do some back anchor connection, remind yourself what muscles we do want to be using, and then apply that to sitting. All right, we have Shane Tucker. I just completed the program a couple of weeks ago. I'm so thankful I found this. I'm 80% better, but I'm still determined to find that last 20%. That's phenomenal, Shane. Is this common with people in the program? Is it recommended to continue the same regimen to get that final bit of relief, or do I need to increase intensity, vary things up? What do you recommend? Really good question. So I'm not sure how long you have been doing core balance training, but what I like to say is, so the goal of the program ultimately is bring our bodies back towards balance. So that's changing not only your posture, but also your actual tissue makeup, like your biology. You're going to be shaped differently, because we're not changing our posture simply by holding ourselves differently. We're actually, ultimately, we're trying to change the length of muscles, like biology, like the sarcomeres in the muscles. The number of sarcomeres will be different. And that, 3 months is a really fast amount of time to do that. And so we do, I would say this is very common. Your question, is it common? Yeah, well, you often, and most students will feel relief in the program. But to actually make that change to your body, 6 months to a year, and that's only one goal. The other goal is to integrate these concepts that are creating the change into the way that you move and relate to your body, so that they do become like what I was just talking about, where it's more of a subconscious intention. You're not really, you're not really like having to think about how you move every second anymore. You're doing life, and you've ingrained this way of relating to your body so much so that you just have to remind it every once in a while. But how do you do that? Yeah, I would say, the way that we end the program is to kind of guide you to pick your maintenance routine, to help you reflect on which are the exercises that have helped you the most, and also to cover all the bases with those exercises. So that plus, the constant goal of getting better, constant goal of improving the skill of listening to your body. And if you understand what's good for your body and what's not good for your body, then you can take that and you can find new exercises and go, oh yeah, like that makes sense to me. This probably would help me. This would probably be a good thing. Or no, that's not really appropriate for my body. And so you can adapt and adjust and add to your routine. But yeah, just continuing the principles of the program. By the time you finish the program, you should have, I would hope that you have internalized almost everything, especially just the concepts of the core engagement. As far as each and every exercise, you don't need to do each and every exercise in the program, but pick your favorites and have done them enough that you can carry them on, and you don't need to actually watch the lesson videos anymore. You just know that you can get better at them, and you can spend 6 more months doing that. It's easy, right? I can still get better at most of the exercises in the program. So that's how you're going to get that last 20%. And that last 20% is possible to get and worth getting. So, and it's not necessarily harder than the first 80%. It's probably just going to take the same amount of effort as that first 80% to get all the rest. But it's a compounding interest, getting out of pain. So as you get out of pain, you're able to do more things, and as you're able to do more things, you're able to get in better shape. So that's the compounding interest that you should take advantage of. Get out there and use your body and use it in healthy ways, and do the things that you're doing in the healthiest way possible as well. So make good choices, and when you make good choices, do them with spinal support. Hopefully that makes sense. All right. Yeah, do more of what's helped and less of what's hurt, and that's the recipe for success. All right, Judy, will you speak specifically about a hip labral tear and its relationship to SI joint back, etc.? I have stenosis, spondy, L4-5, arthritis. I'm in module 8, day 2, and feel a huge improvement since starting CBT, especially in the low back with little pain, but constant pain in the left hip groin area, and other mild pain moves around in SI joints. Outer hip groin area seems to have a glitch or give out when I bend to pick something up. Stand up. Okay. So there was kind of a lot there, but we'll talk about labral tear since that was the first question. So the hip labrum is just like the shoulder labrum in that it is it's a ball and socket joint, and you have this sheath that covers that ball and socket with basically ligament type tissue, collagen type tissue. And when that labrum tears, what happens is you lose two things. One, you lose the pressure that's supposed to be inside that joint. So every joint is enclosed in a joint capsule, and in that capsule is pressure that is similar to pressure in shocks, and it just helps to prevent breakdown. So when you lose that pressure, then you're going to be more susceptible to feeling activity. After you do activity, you're going to be more susceptible to feeling the after effects of soreness and stuff like that, because you just lost that one little extra thing that joints have as a tool, is that pressure inside the joint capsule. And also, the synovial fluid that's inside the joints. So that's part of the pressure, the hydraulic pressure, if you want to call it, that can leak out as well. So it's a little bit of a disadvantage, but it doesn't mean the end of anything. It just means you need to be more accountable for how much activity and stress that you expose your joints to, and it's even more important to keep those joints in alignment. So why do labral tears happen? In my opinion, it's going to be a combination of repetitive trauma, so overuse, but also combined with the joint not being in a congruent position. So the ball may not be perfectly in the socket like this, operating like this. It may be slightly off. And so there may be some more friction happening at one end of the ball and socket, and that can cause breakdown. So what causes joints to be incongruent? Well, the question really I just asked is what holds joints in place? The muscles. The muscles hold the joints in place. What determines how the muscles hold joints in place? Well, it's a neuromuscular system, right? It's posture, tone. We have muscle tone. We have the way that we use our bodies. We have lifestyle. And so these are all this is if you want to get to the root cause of something, you have to keep asking this question. Why does that happen? Why does that happen? So it's ultimately going to come down to, you know, your the way that you use your body. And so we're going to zoom back in now. So how can you improve your joint congruency? Well, we want to bring our bodies into balance, our muscles into balance, because the muscles hold the joints in place. Well, how do you do that? Well, typically you learn the pattern of what's the predictable pattern of imbalance that most of us fall into. Well, it's related to sitting. It's basically the sitting posture. The hip extensors, like the glutes, are lengthened and the hip flexors are shortened. Okay, let's look at the picture of that. Let's look at a picture of that because I think that'll be the most helpful. Here is a picture. Let me zoom out of hip extensors lengthened and hip flexors shortened. So I turned this on its side because I think it was supposed to be something else. But imagine that this is a person sitting. Both legs are in this position. Well, when this muscle is chronically shortened due to just our modern day lifestyle, where, it's not an individual problem, it's a societal problem, and this muscle is lengthened, and these are on the two sides of the joint. And it's not just one muscle, by the way, it's all the muscles in the front and all the muscles in the back. And so the two sides of the joint, we have a lengthened side and a shortened side. That's going to pull that ball in the socket probably towards the shortened side, is probably pulling it forward. And that's what happens in the hip joint, is that ball of the femur typically gets pulled forward in the joint, and it pinches in the front of the joint. And that's why most hip labral tears, or FAI, femoral acetabular impingement, is happening in the front of the hip, because that ball is being pulled forward towards the front of the socket, pinching the labrum. And so that happens repetitively enough, it's going to cause a tear. And so anyway, getting back to the solution, we want to restore balance. We want to lengthen these muscles and shorten these muscles. And this is going to be a constant battle, because even if you do a brilliant exercise like the bridge, which will help to restore that if you're doing the bridge in the right way, we still have this societal norms where we sit to work at a computer, we sit to eat dinner, we sit to drive, we sit to watch Netflix. And so it doesn't mean it's over, that we found the bridge. It's going to be, like I said, a constant thing to maintain for us, for me, for you, to continue to get better at it, to continue to integrate it in our lives. Here's a picture of the ball and socket. And I don't know if I have a good angle for, like, the hand is in the way there. Here is a diagonal angle. So yeah, the pinching happens right there, and that's where the tears happen. And the ball is just slightly pulled forward by all the tight tissues on this side. So yeah, the constant struggle, the constant battle, the constant dance of restoring balance in your body is something we all have to fight that fight. And the bridge is one of the better tools that I know, if not the best, but it's also adjusting your lifestyle. Walking is a really good, I love this image of just showing the balance that is required around the hip joint to, how easy does this image show that? How easy is it for the muscles to have an influence on how the joints sit? They have the biggest influence on how the joints sit. So we want to have balance between these front ones and these back ones. Should have showed this image earlier. Just stare at it forever. Okay, so walking, bridge, front anchor awareness and progression exercises are fantastic for lengthening these. That's module 2. And shortening these and trying to pull that ball to the back of the socket. And not aggressively, like getting manipulations doing it, but addressing the things that are holding that ball in place, which is the muscles. So hopefully that answer helped not just you, Judy, but other people as well, to just get a better understanding of what we're dealing with here. It is pretty, I would say, what's the word? Pervasive. It's a pervasive problem. And all these conditions, these diagnoses are really just results of the mother problem that we're dealing with. And we can give them all different names and make you feel like you have 15 different problems and you're broken. But really, when you have extra friction in your body, and that's going to have a chain reaction, and it's just going to have this breakdown a little sooner and this breakdown a little sooner. And it's really not 15 different conditions you have. You have one condition, and there are numerous results from that. That's the way I look at it. I could be wrong. Constant pain in the left hip groin area. This is another symptom of the monster of muscle imbalances that we deal with. It's the hip flexors and the hip adductors are the ones that get tight. The hip extensors and the hip abductors, the opposite of the groin muscles, are the ones that tend to get weak and lengthened. And so by strengthening the abductors, you can help reduce that tension and pain in the groin. So and the glitch may be related to the FAI. I can't really be sure about that, but there's definitely that's definitely a symptom people feel when there's ligamentous damage. Is this give out thing that happens? Yeah. All right, Brian Snedden, have you ever had an issue with pelvic misalignment, specifically sacral torsion, upslip, downslip, etc.? Does that have to be manipulated in order to get pain relief? What's your opinion? I've spoken a lot about this, Brian, so it's funny, I just showed this image, which is like, I made an entire stream and YouTube video about this topic where I said, if you have, SI joint misalignment, do not do this. And there's an entire video explaining why. So instead of going on my rant, which takes me a half an hour, I'm going to strongly suggest, because I know that you haven't seen this video. You're going to get my best of my best answer to your question by watching the YouTube video about that topic. And it's just something about SI joint. Do not do this. And you'll find it on the Core Balance Training YouTube channel, where you're watching this live stream right now. All right, Gregory Henderson. Hi, Dr. Ryan. I just joined your program this past Monday. I had a question about the exercises. I'm only to do the exercise one time in the morning, or can I do it more than once in a day? Great question, Gregory. You can absolutely do it more than once in a day. Module 1, Module 2, Module 3, Module 4. are all exercises that you can do. Really, you can't really overdo them. I mean, you could maybe overdo the bridge, but that would be hard, and I'd be proud if you did. So you can do them a lot. Some people do them 3 times a day. And yeah, it's possible to overdo the bridge. Back anchor awareness, front anchor awareness exercises, which is going to be module 2 coming up for you. Yeah, you could do those 5 times a day, and your body would probably feel amazing if you did that. So that's my answer. 3 times a day is a safe bet if you're a super motivated person. And then just listen to your body. The bridge will communicate to you if you overdo it. The hamstrings might get sore, most likely. But we're trying to get those glutes involved. So once you get later in the program, you're going to be doing more things like the deadlift and the squat. And those are muscles that need a couple days off after if you go intensely. So you're not going to be doing multiple times a day. All right, Lori, I have meralgia paresthetica that manifests as shooting lateral thigh nerve pain. I can walk and lie down often without shocks. Sitting sends electric shocks, and abduction of thigh does also. Suggestions. I've heard of this, and I don't have any like, oh, I'm going to give you the cure type suggestions, but in general, with nerves, it's not my recommendation to kind of push through pain. I would be listening to the nerve and letting that shooting pain be your guidance to stop before that happens. So that's your threshold, and you want to avoid crossing that threshold with exercise. So you want to go right up to it and stop just before it. So that requires really deeply tuning into your body and knowing where your threshold is. And that does change. And the goal is going to be to change the threshold by doing that. So we can actually have an impact. Say you're lifting your leg up, say abducting the leg, which is one of the things that triggers your pain. You're abducting your leg and you go right up before that trigger happens, and you stop and you come back down so you don't cause the nerve shooting pain. What we know from science is that you actually have an effect that is 10% further range of motion than where you actually went in the muscles. And so it's as if you were able to go 10% further, and the muscles gained strength in that range of 10% further than you actually went. And that may affect your posture and your body and your threshold. And so maybe if you do that enough, training up to that threshold, you're going to strengthen 10% past that threshold. Maybe that pushes your threshold out a little bit. And then you can continue doing that, and maybe potentially, ultimately you want to change the shape of your muscles and your body because that nerve is getting irritated through movement. And so maybe we need to, it might be related to posture, or at least we definitely know that it's related to joint range of motion. And posture is closely related to that. So we want to change something about your body to increase its resilience, and maybe even change where the pathway that nerve is taking. But definitely we don't want to push through it. And the reason is because nerves don't like being irritated. They don't like being inflamed, and they become more sensitive. So we want to reduce that inflammation on the nerve, but still be able to train the muscles around it. So hopefully that makes sense for you, Lori. Ms. Tran, overall, I have improved strength, mobility, and less pain. Also added more weight reps slowly to enhance my progression. I've noticed my SI joint clicking has changed from left to right. Ooh, that's a very interesting change. Have you experienced something similar in your healing journey? And what does it signal if you can elaborate? So the big picture change that you're experiencing is that you've stabilized one of the SI joint that you've been dealing with for a long time. So hats off to you. Congratulations. That's massive, because the longer a problem goes on, the harder it is to fix. Now you now have clicking on the other side, but the good news is it hasn't been going on for very long. It's a brand new thing. Your body's changed. You've changed something about your body to switch it to the other side. Are you perfect yet? No, but you're in a much better situation than you were having, clicking and pain in one SI joint. Say you've been having it for 2 years versus having clicking and pain in the other SI joint for 2 weeks. You can bet which one I'll pick. It was much easier to address a problem that is in the acute phase, or subacute, rather than a chronic problem. So when we change our body, things move, pain moves, symptoms move, and that's a good sign. Typically a good sign. It means you're addressing the problem, but it also means you have more work to do. And so you want to address this new problem with that same approach that you did the original one, because it worked. And so you might have to make a few modifications and adjustments to just be addressing the other side of your body, and then do whatever worked for you. All right. And yes, I have experienced something similar, to answer your question. Absolutely. All right, let's go to Adam Sheehan. Hey, Dr. P, I'm almost done with Module 10. My entire back from my butt to my shoulder blades seems to be in spasm. I can't even stand up straight to engage my anchors. I've tried to release it over probably a Swiss ball, but no luck. I can still do the bridges, but nothing else. Any suggestions to try and get the spasm to release? I haven't had one this bad since starting the program. The spasm happened suddenly as I was getting out of my vehicle. All right. Getting out of your vehicle was the final straw for your body. Was it the cause? Probably not, but something about being in your vehicle and or getting out of it was a trigger. So let's talk about that. Sitting, okay, definitely, generally not a good thing. Driving especially puts even more strain on it, because you're actively moving your legs. You're basically exercising one leg while sitting. Gas, pedal, brake, pedal, gas, pedal, brake, pedal. And then getting out of the car can be a flexion mechanism, bending forward, twisting and bending forward combination. It's not really going to be backward bending. So to me, we have a mechanism of injury, Adam Sheehan, of forward bending or a little bit of twisting going on. So we go back and we look at your post here, and you say laying over the Swiss ball. What does that do to the spine? Well, if we really break it down, it's a forward bending of the spine. So your mechanism of injury is the same as what the Swiss ball is doing. By laying over a Swiss ball, you're in an extreme way, you're forward bending the spine, you're stretching those ligaments. So that's why that's how I would explain that the laying over the Swiss ball is not going to give you relief. It's not going to help you, and it may actually make things worse, to be honest. Bridging, on the other hand, if you are not really heavily biasing towards a posterior tilt in the bridge, you're not getting any forward bending. So you can bridge and be in neutral or even maybe even extension and not be causing a problem. So when you're looking at your body and the exercise or the relief method that you're going to do, I would be considering the mechanism of, all right, is it going to cause a forward bend in my spine? Then I probably shouldn't do it right now because that was what caused it. Maybe also a little bit of that twisting too. I don't know. I'm not sure, but getting out of the car can be, for some people, some techniques can cause twisting. So relief methods I would definitely be considering would be laying prone, laying on your stomach on the floor, even throwing in some front anchor push away, module 2 stuff. And laying on your back, if your legs are elevated, is going to be going into a posterior tilt. It's similar to forward bending. So I wouldn't be laying on my back with the legs elevated. I would be considering laying on my back without the legs elevated or laying prone. And then exercises all just similar. I wouldn't be doing anything forward bending wise. So it's possible that this is a message to you. I mean, this is a message to you, Adam, that maybe over a long period of time that you've been over biasing towards a forward bend or a posterior tilt, and your body finally broke down and said, I don't love that. So you want to be more go more towards a neutral. And look back into your past and look at like what's caused your back pain and your spasms in the past, and see if you can find a theme there, and connect the dots. But that might be a little bit of the beginning of a tale to chase. All right. Enjoy life. I completed my 1-week trial on Monday with some relief to my symptoms. I want to continue module 1 to do the bridge properly. Do I do the same routine that was on the last day of the trial? Was there a routine there? I don't even remember. Yeah. Oh, the daily routine. Yeah. So yeah, I would consider doing that and keep working on the bridge, and don't hold back from just giving yourself a taste of module 2, just so you know what's coming. I think it's important to get exposed to the front anchors, even if you're not going to do the whole module, but just to know what's coming. Just module 2, day 1. And go through that same routine with just working on the breathing, the back anchor progression, the marching, and the bridge. And the floor angel is a good one too. Yeah, good question. All right, Ms. Tran, how many exercises do you usually practice per day? And thanks for always being very positive and encouraging. We do really need your spirit to guide us through the. Hey, thank you, Ms. Tran. How many exercises do I practice per day? Every day is completely different. Some days I don't do any exercises. Some days, like yesterday, which would be a rare day, I probably did 5. I did squats, deadlifts, push-ups, and I don't even know if I bridged yesterday, but I did the floor angel because I love that one. And so, and I did some pool training that I have started really enjoying, that I'm going to teach you guys soon. But all of this stuff, it doesn't really matter what I'm doing. It's all, any exercise you give me, I'm just going to incorporate this core engagement to it, and it becomes a core exercise. I could be doing military press, and it's a core exercise. So it doesn't really matter. I'm turning everything I do. Maybe I'm not actually exercising. I'm just going for a walk or going for a bike ride or going for a paddle. I'm trying to turn it into a core exercise. I'm thinking about my core. The more intense the activity I'm doing, the more I'm thinking about my core. The more low level the activity is, the more it's just kind of like become more ingrained. But hopefully every day I do one thing, at least a walk, but on good days I'll do more than a walk. I'll go surf, or I'll go to the gym, or I'd say 3-4 days a week I'll bridge and single leg bridge as well. All right, and thank you for the gratitude, Miss Tran. Judy, is there anything I can do to get the groin area, hip labral tear stronger? It feels weak when it gives out. So the giving out is most likely more of a neurological reaction that happens. And it happens to people with meniscus injuries, sometimes ACL tears. There'll just be a point where the muscles just turn off and their knee gives out. It seems neurological, and it's related to the injury to the ligament, the labrum, or whatever you want to call it. It's similar, type tissue. So supporting that with what we talked about earlier, the muscular balance around the hip, getting stronger. Absolutely. Is there something you can do? The groin area is painful, but it's most likely kind of tight. And so you want to strengthen the outside of your hip, the opposite of the groin area. The groin is the adductors, so you want to be doing more abductor work to help support your hip. Is a very, very beneficial thing to do to support the hip. Squats, deadlifts, single leg stuff, lots of single leg stuff. If you can build your strength up, I don't know your fitness level, Judy, but if you can build your strength up to someday be able to do a single leg sit to stand from a chair, so that means standing up on one leg from a chair without your arms, or a single leg squat, hey, your hip's going to be good. Your knee's going to be good. You're going to be in a very good shape. So that would make that the goal and work up towards that. John Paoloni, thank you for suggesting I keep with module 2. Halfway through it, I started incorrectly pushing away from my upper front anchor. All fixed now and moving on to module 3. You're very welcome, John. Ariana, doctor, first of all, thanks to you and your team for all this training and all the support. Is swimming good for SI joint? You're very welcome, first of all, Ariana. Is swimming good for the SI joint? I stopped going to the gym and biking probably, at least for 8 weeks. Then I'll be reintroducing slowly and see what happens. Because I watched your do's and don'ts video, I am seem to be hurting more. Is this normal? Is there any form of exercising you would advise other than walking to keep active? Yeah, lots of exercises to keep active. If you're dealing with SI joint, swimming, it's going to be to the individual whether swimming feels good or bad. Typically, swimming is not good for ligament injuries, knee, MCL, ankle. And the reason is because they're open chain. Swimming is open chain. So your joints are just moving through the water loosely. And when that happens, there's no fixed. So we can talk a little bit about the difference between open chain and closed chain. But when you're just swimming and your joints are just moving through the water, there's no support. Say your wrist ligaments were injured. There's nothing that for your hand to be fixed to, like the ground or a wall, which would help the muscles and help just the joint to have stability. So typically, I don't recommend swimming for ligament injuries. An SI joint is a ligament injury, but the SI joint is so central in your body, and if you're not swimming in an extreme fashion and overextending your legs and stuff, it may be okay. So I would give it a try as a way to stay fit and see, and your body will tell you if it irritates your SI joint. It's just not obvious. It is obvious if you have an ankle injury or a wrist injury or a knee injury. I would not recommend swimming. I stopped going to the gym and biking I wouldn't just stop everything. So this is not surprising that your body is hurting more because it seems like you stopped everything. When we are used to doing something regularly that keeps us fit, and then we just stop, the fitness goes down. Your muscles that are relying on that level of fitness to operate the way they like to goes down, and typically it's not going to be a good outcome. So I wouldn't stop going to the gym. Maybe biking or reduced biking or modifying the way you bike, and continue going to the gym. Just modify what you do at the gym and integrate the core anchors and the core connections to what you do. And like what I was talking about earlier, like I'm squatting and deadlifting at the gym, which is like the most common exercise in the world. So it doesn't sound like I'm doing anything special, but it's the way that I'm engaging my core when I do those things that makes them good for me. If I were to just squat or deadlift with my core turned off or engaged in an unhealthy way, that could hurt me. So it's the way that I'm engaging them. I'm applying the core engagement that we learn in the program to those exercises, and that's what I would want you to do at the gym. So yes, this is normal. And other than walking, I would say everything I just said, plus, you can hike, going like backpacking up hills is really good. Stand up paddleboarding is a fantastic exercise. I would even say certain sports, if you like to play, like tennis, are really good for the body. Those lateral movements. There's a lot you can do. Is more about how you do them. Much more about how you do them than like actually what you're doing. All right. Mary Prusa, right side SI pain. Did I skip anybody? No, I don't think I did. Let me just check the bottom of the chat here. All right. I've been going for an hour. Is there a last question? Nobody. Oh, there it is. Last question. So I guess I'm going to go to the last question today. So my answers have been long today, but that's why we're already into an hour. So here we go. Mary, right side SI pain. Finished the first week with improvement. However, hamstring really tight and right glute won't engage. Thoughts on the McGill Big 3 and clamshells? Thanks. So, where should I start? Tight hamstring from the bridge, very common. Most likely an indicator that you're kind of, just in general, your movement pattern is heavily using your hamstrings. And what we want to do is gradually over time increase the participation of your glutes. And not only the bridge, we'll start with the bridge because it's a fantastic training ground for this, you learn how to do this, but with all the movement you do. So more participation from the glutes to support your pelvis and take the load off of the hamstrings. They're overworking, most likely, highly likely. And so what do muscles do when they're overworked and tired and irritated? They tighten up. So we bring in the glutes more, sometimes muscles can be very stubborn. So you have to like imagine trying to start a car that won't start and it's just turning over, and it won't actually start. That's what you're doing by bridging. You're trying to start the glutes up, and maybe it'll take 10 attempts, 10 days to start to get that glute to activate. And we've had students in the past that have they've been vocal in the chat about this. They've definitely dealt with this gluteal amnesia. It forgot how to function. And then one day, they start up. And then you start training them. So you want to just be persistent and keep giving the glutes that trigger, trying to start the car. Because if you just give up, and then the car's never going to start, right? But if you keep going, maybe one of those times it'll actually start. McGill Big 3, I think that they're 3 exercises that are really beneficial for the body. The side plank, the one is like a really specific way to do like a bird dog, I think. He has a really specific way to do it. And then I forgot the third exercise, but they're beneficial exercises if done right, for sure. Yeah. Do I want to talk about the problem with it? It's the same problem with physical therapy. It doesn't translate into how you wash the dishes. I mean, without training, you could translate them into how you wash the dishes, but there's a big gap there. And that's the gap that I would like to fill, is how do you turn training into something that benefits you the 15, 16 hours of the day that you're using your body, not just the 30 minutes that you're doing the exercises. All right. Clamshells. Yeah, clamshells are a great super low level, beginner level way to activate the glutes. So that would be something I would attempt on the right glute as another way to start trying to start that engine. There's a specific way to do the clamshell for maximum glute contraction and involvement. So you're not getting compensation from your hip flexors, namely the TFL. So I'm going to say this right now, but I'm not going to go into detail about it. So just pay attention if you're still here. Your hip angle is at 60 degrees flexion. So your hips are mostly open past 90. So they count hip flexion from straight leg being 0. So if your leg is straight, that's 0 degrees hip flexion. How do I do this for you guys? If your leg is straight, that's 0 degrees hip flexion. Here we go. This guy's in 0 degrees hip flexion. As I bring my knee up, the numbers count up. So this would be 90 degrees hip flexion. So we want 60 degrees hip flexion for the clamshell and 90 degrees knee flexion. So 60 hip, 90 knee. And then you want to make sure you're turned all the way on your side, kind of like this girl. So you don't want to be rolled back. You want to be rolled almost forward like she is, like the position she's in. And that will ensure maximum glute contraction. Okay, so I would recommend clamshells for helping out that right glute. Good question, Mary. Matthew Binder, if I were to go get prolotherapy injections in my SI ligaments, is there an optimum point in the program to do this to maximize the benefit? No, I would just do it earlier in the program. Good question, Matthew, but there's no optimum point. I would do it even before I started the program, but you want to be doing the right thing while you're getting prolo. So hopefully the program is the right thing for you, and earlier better. Yep. Dina Roberts, newbie here. Welcome. Other programs I've used have directives to not override the natural curves in the spine, but so far in CBT, we're actively flattening the spine. Clarification, please. Okay. So, Dina, how do I teach these kids? So in the lessons I have written throughout, like module 1 and hopefully in bold, and if not bold, capital letters will be coming soon, that we are not flattening the lower back. We are not
smashing the lumbar spine into the floor, or this is different than a posterior pelvic tilt. The back anchor connection is above, the back anchor is above the lumbar spine. It's the thoracic spine. The bottom of the rib cage is connected to the thoracic spine. So what we're pushing into the floor is here, the back anchor zone. And the lumbar spine is here. When we push this into the floor, does this flatten? Yeah, a little bit. It goes towards flattening, but is it going to flatten completely? No, because this will contact the floor first. And so we have some curvature left in our lumbar spine, ideally. And if in your case it is flattening all the way, that's okay. What I tell people is just let the lumbar spine do what it's going to do. Don't really focus on it. Focus your attention on the back anchor. Connect the back anchor to the floor. Connect the bottom of the rib cage and the back to the floor, and then push into it. Push away from it. Now, if the lumbar spine maintains a little bit of curvature in it, that's okay. If the lumbar spine flattens, it's okay. Just let it go for the ride. Now, where do I want to go next with this? Why do we go? So we're not instructing you to flatten your lower back. We're not instructing you to smash your lower back into the floor. But there is a decrease in the lordosis of the lumbar spine with our instruction. We can all agree on that. We are moving towards flattening or a more straight lumbar spine. So why are we instructing that? Let's answer that question for you, Dina. So most people that have chronic lower back pain fall into the category, and this is my belief, maybe I'm wrong, but this is my belief, is they fall into the category of having anterior pelvic tilt. So here is something. Oh God, I can't even move those. Where can I show anterior tilt? Here we go. Well, there's all kinds of images, but pelvis tilts forward and the lumbar spine goes into hyperlordosis, what they call hyperlordosis, too much spinal curvature. So when we have too much spinal curvature, we want to go towards less spinal curvature, which is towards flattening of the lumbar spine, but we don't want a completely straight lumbar spine. We want to have some natural curvature. It's just less than what most people are prone to when we're living in a position of hyperlordosis, living in a position of spinal extension. And so that's the answer. Yes, we like natural curvature. Yes, we are trying to maintain that, but we are out of balance and we want to get towards more balance. And so I'm with all of the other programs that you've done, and that this natural curvature of the spine is good and healthy, and it actually helps with shock absorption. But for a lot of us, we just want to reduce that curvature a little bit. And so hopefully that gives you an explanation that you were looking for. Sean Breckenridge. Hi, Dr. Ryan. A big thank you and the entire CBT team. After so many years, I feel like I can fully engage in my life again. Hey, that is music to my ears. That is the goal. Because really, it's like that, what you just said is why I am doing this, why I'm here. It's not to improve people's posture. It's not to get muscular balance.
those are all just means to an end, and the end is to be able to enjoy our life. And so I appreciate the way that you phrased that. You're very welcome. That's it. You're just saying thank you. I love it. Christy Elson, is using a vibration plate a bad idea with SI joint pain? I also want to say thank you for helping me get out of pain and have a tool for any time it starts hurting. Oh, that's beautiful, Christy. Thank you. So, vibration plate. Vibration plate's going to be interesting. It's always been an interesting thing to me. I feel like the benefits are the potential benefits, like theoretically, are that it can just kind of wake up nerves and muscles and maybe help activate and just, I don't know. I don't really know. Maybe relax things and activate things. I haven't dove into the research on that. But the downside, I can be sure, is that if you have an issue with a joint incongruency or friction, well, let's just say friction, and your spine has a problem like where are we? I'm not seeing it. I'm having trouble finding images today that I want to show you guys. Anyway, spine is not congruent, not looking good. I don't like this image, but we'll show it like that. This is not a real, I don't know if this is realistic, but let's say it is. Say your spine kind of has an issue like this. I think vibrating this would make it worse. I think vibrating would just help break down even further, or something like this. If you have vertebrae touching, you don't want to really vibrate disc issues, and that's something I can be pretty confident about. Discs don't like vibration. Nerves and muscles and joints, I'm not really sure. So I'm sure about the downside for certain people. I'm not sure about the upside. And that's how I feel about vibration plates. I don't know that like it really does a whole lot to help, but if it does for you, then there's only one way to find out, and that's to try. So I'm going to scan through. I'm going for about an hour and 20 almost. So I'm done answering questions, but I'm going to scan through, just see what people have to say, and get ideas for future topics. So we have one for sleeping, Gil, grateful for the program, and laying in bed or sleeping. Yep, unanchored for long periods of time. Yep, we can talk about that in the future. I probably can do some bed or sleeping topics, or even lesson videos for the program coming up here. So that's a good one. Module 3. Okay, you go to fusion. Seems the pain level is different daily. Is this normal? Yeah, SI joint pain fluctuates a lot. Pubic bone alignment. I really would just highly suggest the front anchor awareness, using the floor to align your pubic bone. Yeah. So I'm going to try not to go deep into these questions. Muscle pain on the side of my pelvis above the greater trochanter. Above the greater trochanter. Okay, some attachments, glute med attachments. So we're getting some tendinitis probably, maybe overdoing it. So those are my thoughts. Determining whether SI or QL issues are present. I don't know what you mean by treating SIM-T. No, I mean, I wouldn't be stretching the SI joint. If you're going to treat the QL, it's just somebody sticking their elbow in there, really. I don't see it's too big of a problem. SI joint pain go into the hip and groin? No, I mean, not typically, maybe. I don't know for sure, but I do think that often people with SI joint pain also have a hip situation going on. Robert Henry, first time here. I'm sorry that I didn't get to your question today, Robert. Oh, you don't have any questions. All right, yeah, I always support that, Robert Henry. No albatross. Only caution if you have SI joint problems. That's okay with me, yeah. Thank you, Robert. That's very nice. This all makes sense, Patricia. Yes, I do. I do think that. I wouldn't do backstroke. I would be doing overhand stroke, what do you call the traditional swimming stroke? I think that's the best one for for your situation, for stenosis situation, because you rotate sideways to breathe rather than extending. Even in backstroke, you're in extension. Thank you, Dan the man from Australia. Still have to visit your country. Dana Law, I'm wondering if a lot of these exercises stretches that you teach in your program are yoga related. Yeah, I'm sure that, yeah, a lot of them are related for sure. Yoga is, I'm a fan of yoga. Spinal decompression. I think I'm going to do a topic on decompression. I'm going to do an entire live stream topic on decompression. Maybe it'll be next week. I really want to do it. Can't wait to do it. There's so many decompression questions and things. Appreciative inquiry. I like that name. I have a live stream on swimming, appreciative inquiry. I would check out the live stream I did on swimming. Soon we're going to be publishing it into a short video, like a 8-minute video, but it's not out yet. All right. I've talked a lot about left-right imbalances recently. I would check out the channel, and we're actually going to be putting out another video on that soon. Just the way you approach exercises left and right. You want to do unilateral exercises and spend more time on the one side. All right. QL glute med. So you're going to want to be giving these muscles more support in the long term. In the short term, Theragun massage, yeah, they could work in the short term, but the long term, you want to give those muscles more support by strengthening all the muscles around them. Yes, it is normal because those muscles are trying to stabilize an instability. So they're just constantly gripping tight around the joint so that they try to stabilize an unstable joint. And that is painful because they're not getting enough blood or oxygen. Best exercises for spondy. We have to have a deep understanding of spondy. And we need to know what could irritate it. And I have put out videos on that, things to stop doing with spondy. And then we kind of want to just do the opposite. I'm going to strongly recommend there is an entire playlist of spondy videos that I've put out on the channel. So go to that playlist, and the one about I do explain everything I want to say right now in those videos. Yep, chiropractic. That is the cause of my spondy. So module 1 of the program should be really good for you, Rafaela. Anybody with a spondy should love module 1 of the program. All right, Lori and Dina, thank you. Thank you. All right, guys. Doc, how's your back been lately? Oh, that's awesome. I don't know if anybody's ever asked me that. And Indy Curry, thank you. And yeah, you are late, but you're still here. So how's my back been lately? This is a good question. I'm going to end with this one. My back has not been the best that it could be lately. I've been working too much, sitting too much, and I would say it's like a 7 out of 10. Before I went on vacation recently, we were in Hawaii, I'd say my back was like a 10 out of 10 for like all of 2024. But something about that traveling and carrying the baby and like just long day. We drove till like 2 a.m. to get home, like not sleeping. Just set me back a little bit. I haven't got back into my routine. So I want to get back to a 10 out of 10. Thank you for asking. But yeah, what does it mean for me? I just, it just doesn't feel like I could just like go like do backflips. I feel like I need to just be a little bit, I have to be a little bit more careful. But I did squat and deadlift, like 150 pounds yesterday. It's not a crazy amount, but it's not nothing. So I mean, overall, I feel good. I'm surfing. I surfed a couple times last week. So yeah, thank you for asking, Southern Flow. I like your name. And that's it, guys. Thank you all for being here. Appreciate you all. Next week, there's going to be a topic. So in the Student Hub, you know what I'm going to do? I'm going to announce the Student Hub Student of the Week. I forget that every week now. Rachel King. Rachel King, you are the Student Hub Student of the Week. I don't know if you're here, but we're recognizing you for offering support to your peers in the Student Hub. Your positive presence has been a guiding light, offering reassurance to fellow students and reminding them to have faith in the process. We appreciate you, Rachel, and we're honoring you by adding a month to your membership. You have to do nothing. We will add it from the back end. And we're going to end on that, everyone. Let Rachel King be an inspiration to you. And until next week, I'm signing off, everybody, and get down on the floor and connect to your core. All right? Take care, everyone.